Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Chromulin series. This audio podcast is part of the Spectro integer, and this audio podcast as part of a Storm Robotics production. Today, looking at sort of hematuria and monitoring. So it is important to establish the cause or causes of hematuria as early as possible, and there are some pitfalls. There are some pitfalls in monitoring consistent hematuria without formal POCT or point of care testing programs in broader community in broader community. For example, sort of in around access to in around access to point of care testing or POCT. So in addition, assessment of glomerular hematuria may be inherited by the presence of non-glomerular presence of non-glomerular hematuria. Microhematuria is not monitored routinely, as is the case with as is the case with some as is the case with a sort of additional or additional sort of some in the case of additional sort of symptoms or symptomologies, as this presents a challenge to evaluation over the over longer durations. Patients or recipients with microhematuria however, therefore require treatments earlier than those without hematuria. Additionally, some of the indications for longer term monitoring in around hematuria, the symptomology around hematuria, is where there's persistent unseen hematuria with or without the symptomology should stimulate investigation for potential urinary tract malignancy in appropriate age cohorts. And secondly, consistent unseen hematuria in the absence of other symptomology should be followed up annually with repeat investigations for hematuria, and arterial blood pressure or ABP monitoring whilst hematuria continues. That draws this audio podcast to a close. This audio podcast as part of the Chromulin series. This audio podcast as part of the Spectro integer, and this audio podcast as part of a Storm Robotics production.